When you start having dreadful dreams and nightmares that send you have dreams that expose you to danger, but there is little or nothing you can do because it's difficult to move your body. It is definitely sleep paralysis. Sleep paralysis is a medical condition, particularly prevalent among teenagers and young adults, in which a person has a feeling of being conscious, yet unable to move. It involves the person passing between the stages of consciousness and unconsciousness. Now, you might probably be wondering what causes sleep paralysis. There are two stages or categories of sleep paralysis, and they include 1. Hypnagogic or predormital form. This occurs when a person is unable to move their body while falling asleep. The brain becomes aware whereas the rest of the body has relaxed into its sleeping state. Many people who have this sleep disorder find it really difficult to fall asleep. 2. Hypnopompic or postdormital form. This is a condition whereby a person is unable to move their body when waking from sleep. Here, the mind wakes up before the rest of the body does. Many people experiencing sleep paralysis have this particular kind. Hallucinations may occur during sleep paralysis. In this case, the person begins to see and imagine things that do not exist in reality. Sleep paralysis may first be noticed in the teenage years and may proceed to one's early 30s. A person with sleep paralysis has the feeling of being conscious and is usually aware of his/her physical environment, yet unable to move. It is what is referred to as an abrupt change from the waking world to the dream world, or vice versa. Normally, the body relaxes during sleep to restore lost energy as well as allow the mind to wander into the dream world. However, when one is suffering from sleep paralysis, there is a snag in this analogy in the sense that the mind wakes up, but the body remains in its rested position. There are several symptoms of sleep paralysis, and they include anxiety, hallucination, paralysis, clinical depression, obstructive sleep apnea, and migraines. There are a number of causes of sleep paralysis, and some of them include 1. Disrupted sleep schedule. When there is a distortion or interference in your sleep routine, it can give way to sleep paralysis. For example, one who constantly finds it difficult to sleep at night can have a warped sleep pattern which gives room for sleep paralysis to occur. 2. Drug abuse. Drug addicts are mostly affected by sleep paralysis because drugs and excessive alcohol are detrimental to sleep patterns. 3. Sleep disorders. People who suffer from sleep disorders such as insomnia, nighttime cramps, and narcolepsy are usually at risk of having sleep paralysis. 4. Stress and anxiety. When one is constantly worked up with busy schedules daily, it leads to stress and anxiety. This condition now culminates to sleep distortions that cause sleep paralysis. How then can you stop sleep paralysis? 1. Prioritize sleep. Sleep is good for both mental, psychological, and physical well-being of an individual. This means that sleep should not be viewed as an afterthought or an activity one engages in after a busy and hectic day. Rather, sleep should be incorporated in your everyday routine, as when you do so, you keep sleep paralysis at bay. 2. Sleeping position. Monitoring your sleeping position and making sure you do not sleep on your back reduces the risk of getting sleep paralysis. 3. Reduce stress and anxiety. Sleep disorders are mostly caused by stress and anxiety. This means a reduction in one's daily workload, and any other activity that causes stress and anxiety will suffice. 4. Abstaining from drugs. Refraining from drugs as well as excessive alcohol intake is a step in the right direction towards preventing and dealing with sleep paralysis. Narcotics have proven to be a leading cause of sleep distortions that later give way for sleep paralysis. Therefore, not involving substance abuse can help stop this condition. 5. Do not entertain fear. Fear torments, and it is one of the fastest killers. Sometimes it is not a sickness or condition that kills a man, but the fear of it. Therefore, it is important not to entertain any form of fear. After being diagnosed with sleep paralysis, remain calm and cheerful, as it is a medical condition with a solution. Constantly follow the doctor's instructions and have the conviction that you will overcome it. Finally, sleep paralysis can be prevented as well as corrected. Therefore, it is pertinent to be in the know of this medical condition and constantly avoid any triggering factor. If you've enjoyed this video, click the subscribe button below and hit the notification bell so you'll know once we post a new video. Also drop a comment below so we can know your thoughts. Finally, don't forget to check the description below for more details and visit our site www.zimsleep.com for more awesome sleep content like this.